Hello, this is Katia, your midwife. In this video, I'm going to show you a few simple exercises to do in case you have a baby with a short lingual frenum, which is tight and is restricting your baby's tongue mobility. So in case the baby has a tongue tie, and if you feel that the baby is not opening the mouth wide enough, these exercises can be done before and or after a surgical procedure for a tongue tie, or in case baby doesn't need an operation, or if you're coping well with the breastfeeding but baby has the occasional bad latch, that's something that you can try. This is not a disruptive wound management, so we're not going to touch the wound if the baby's had the tongue ties nipped. These are all exercises that are done on top of the tongue and on the palate. The first exercise is called the desensitizing exercise of the palate. Babies with a tongue tie may tend to have a gag reflex. So that means if the latch is too deep, they may gag. So they may look like they're choking or they're about to bring up some milk. Okay, so how is it done? So I've got my little helper here. I'm going to go with my finger with the pad side up on top of the roof of the mouth of the baby. So I'm going to go from the top lip. I'm going to enter the palate. Some babies may have quite a bit of a gag reflex as soon as you put your finger inside of a palate like that. If that happens, so if you just touch the tip of the palate, just the front of the palate, you may apply a light pressure on the hard palate of the baby, on the front of the hard palate of the baby, and that can help to relieve that gag reflex. After you've done that, if the baby is not gagging, if the baby is comfortable with you having your finger placed towards their palate, you can start swiping your finger from side to side of the palate and slowly move backwards up to the point when they start gagging, or anyway up to the point where the palate is not hard anymore and the soft palate starts. Okay, and then from here, then you gently swipe the finger back towards the front of the baby's palate, and then you start all over again. So from the front, just do this kind of 180-degree angle movement with your finger up to the soft palate or wherever the baby's starting gagging, and then after that you stop and then slide the finger along the roof of the mouth. Okay, and you can do it at least 3 to 4 times. Do it a couple of times a day or even once a day. But the more you do it, the more you're going to help the baby desensitize their palate. Okay, and the gag reflex will subside. The second exercise is for those babies who do not gape, so they don't open their mouth wide enough. And it also helps to move the tongue a bit better. Okay, so I'm going to place my finger with the nail side up into the baby's mouth, on the tongue, in the midline of their tongue. So this is the tongue, okay, midline of the tongue. And then I'm going to start swiping my fingers sideways back to the center, and then again on the other side, back to the center and to the other side. And I want to do it for at least 10 to 15 seconds. And this movement stimulates the transverse intrinsic muscle of the tongue, okay? And that will help the baby to make that nice little cup around the breast. And then after that, we're going to move on by stimulating the gape. And we're going to stroke the top lip downwards. So, going to stroke the top lip downwards. Like that, in case they don't gape the mouth, and they would open the mouth. And that way, what you're doing is basically you're imitating what you would do with the nipple. So nipple towards the nose and the tip of the mouth, and they would open the mouth, okay? So they would do this movement leading with the chin and opening the mouth. Once they've opened the mouth, you just put your finger again, nail side up, on the baby's tongue. I'm just going to take the tongue out a bit more just to show you the tongue a bit better. And then you start moving the finger in and out, in and out. Okay, so you slide the finger along the midline of the tongue to halfway back. Okay, in and out, in and out. And you repeat that as long as it's tolerated by the baby. Okay. Then again, you stimulate the gape by stroking the top lip downwards. Then you slide the finger in as soon as they open the mouth. Slide the finger in again. Again, I'm just going to take the tongue a bit more out so you can see it better. Slide the finger in along the midline of the tongue and press down as you slide the finger out. And then you start all over again. Go back on the tongue and press down. This also helps for those babies who tend to retract their tongue a lot. Okay, so these are quite simple exercises to help babies open the mouth wide from the inside and move their tongue a bit better. Okay, another variation of this exercise is the tug of war exercise. So this time I'm going to place my finger, could be the medium finger, the mid finger, or the index, inside of the baby's mouth with my palm facing up. And then I'm going to do the movement that we've done before to start stimulating the tongue. Could be that you're pressing your finger against the tongue a little bit, or you can just keep it in the baby's mouth. Then once they start sucking and you feel that they're cupping your finger nicely and they've got quite a firm grip on your finger, you can start trying to pull your finger in and out, as if you're just getting them to make a stronger suck. Okay? Do it as long as it's tolerated by the baby. This could be a way to calm the baby down as well and to soothe them when they are very unsettled or they don't want to get the breast straight away. Okay? In case babies are really unsettled and frustrated and they are struggling to get a right latch, it's always a good practice to do lots of skin to skin, offer your finger to suck, to soothe them and also to help them suck a bit better. And then once the baby is calm, then you try again. Maybe change position. That helps the baby to focus again, to reset and refocus on the breast. If you feel very anxious and very upset, maybe give the baby to dad or to somebody else to help you take a little break and then start all over again. If you like this video and found it interesting, do let me know. If you have any more questions, again, do let me know. Don't hesitate to ask for help and support. Thank you very much. Bye-bye.